Jolene Johnson, Program Director for Warren General Hospital's Advanced Wound Care and Hyperbaric Medicine Center. I'm here to show you our area and introduce you to the team who will be available to support all your needs with wound care. Follow me. This is Beth. Beth is our front desk coordinator receptionist. You'll meet her every day that you come for your treatments. She's very nice and will be very helpful getting you your appointments scheduled and your tests scheduled and everything else that you might need while you're here. In the wound center, we have 3 treatment rooms and the hyperbaric chamber. To my left here is our large treatment room with a stretcher in there for patients who have problems on the posterior side of their body, and they need to be on a stretcher so that we can access and care for them appropriately. We have our physician consultation room. This is where the doctors and the providers come and take care of their documentation and sit and talk if they need to with the patients. Right now we have 3 providers. Dr. Philip Vucolo is our medical director, and he's here every Wednesday all day. We have Dr. Brower, who is here every Tuesday morning for half a day, and LaTroy Navaroli, who is a certified registered nurse practitioner, and she's here every Tuesday and Thursday afternoon. We also have Dr. Mason Tutel, who is a supervising physician for our hyperbaric therapy treatments. He supervises our hyperbaric techs when they are administering hyperbaric medicine. There are 2 other treatment rooms. You can see we have very nice equipment for your comfort. These chairs go up and back, and so your comfort and care is foremost in our treatment process. We have all kinds of stuff here for debridement of wounds and dressings. We do total contact casts. We do Una boots and compression dressings. We do all kinds of things depending on where your wound is. So we're seeing quite a few different patients every day. This is our lead RN, Andy Skirta. And he is also a clinical nurse here for wounds, and he is a hyperbaric technician also. Hyperbaric chamber consists of 2 units. We call this one A, this one B, and this is Sherry. Sherry Swab is our LPN, and she's our lead hyperbaric technician. And she will be the one who cares for you on a daily basis with regards to hyperbaric medicine. She works very closely with our providers and our panel to make sure that your care is safe and successful.
These are hyperbaric oxygen chambers. Patient is slid into the chamber. They're in there for approximately 2.5 hours, 5 days a week. And while they're in there, there is 100% pure oxygen pumped into the chamber, and it is pressurized to about 2.5 atmospheres below sea level. And as you're being pressurized with 100% pure oxygen, it allows the bloodstream to carry more oxygen to all parts of the body to enhance with the healing. And you can watch television while you're in there. There's a telephone where we can communicate back and forth, and I sit right there close by keeping an eye on you the whole time.
Yeah, you're never in here alone. And the provider comes down, supervising provider, it could be Dr. Tutel or Dr. Vucolo or Dr. Brower or LaTroy, and they will greet you before you go in. They check certain things. If you're diabetic, we have to make sure your blood sugars are within a safe range, not too low, and if how your ears look. Those are a couple of items that are really important, because as you get pressurized, your body reacts a certain way, and we want to make sure you stay safe and don't have any untoward events. The wound hyperbaric treatments have had huge success. There's a ton of literature on it, and we're hoping that it will benefit our community as well.
People that we initially had 10 or so years ago when they were seeing us now don't have to travel nearly as far. A lot of the patients were going to Erie, Pittsburgh,
Du Bois
to receive the hyperbaric treatment, even wound care in general, and now they're able to do it here again.
Unity.
Yeah, so we have engaged providers
Very good.
who are able to cover us Monday through Friday, which allows for this to be operational and maximize the benefit to the community. So.